counter. Hello, this is Dr. Kwun. Is this Mrs. Smith?
Yes, it is.
Hi, Mrs. Smith. Could I check whether it's a good time to speak to you?
Yes, it's fine.
Thank you. Can I confirm your date of birth, please?
Yeah, so it's the 23rd of April, 1974.
Thank you. As part of my clinic today, I'm recording my consultation. This is solely for training and assessment purposes. Are you happy with that?
Yeah, that's fine.
Thank you. If at any time or at the end you're not happy with the recording, please let me know. You can withdraw your consent.
Okay.
How can I help?
Well, I was out walking my dog yesterday morning, and then I suddenly kind of had some chest pain. It was as I was walking uphill, and I had to stop for a few minutes because I couldn't go all the way.
So this is a new chest pain that you've had. Are you having any pain at the moment?
Right now, not so much, just because I'm not really doing anything, but at the time when I was coming.
So right now, not so much. Are you pain-free at the moment? Because this will change how we're going to manage you. It's very important to know whether you're having any chest pain now.
Yeah, no, at the moment I'm pain-free.
Okay. Could you tell me, when you had this chest pain, whereabouts was it?
It was like a constricting pain at the center-ish of my chest. And as I was having that, I was a little bit breathless. Whether that was to do with the hill or not, I'm not sure, but that's what I was experiencing.
Did you have it at rest as well?
Not really at rest, because it got better afterwards, but it kind of started gradually, but once the pain was bad and I rested for a bit, it was fine.
Did the pain spread to your arm or neck?
No, not really.
Did you have any clamminess or feeling sick?
No, not really, no.
And have you had any thoughts as to what this is?
I'm not really sure. I was just a bit worried because heart conditions run in my family, and my late father passed away from a heart attack at the age of 57ish, and I'm kind of reaching that age. That's it, pretty much.
I hear what you're saying. It's quite concerning, especially if you had a family history. So, in terms of the chest pain that you've had, when was the last time you had a chest pain, Mr. Smith?
Oh, it was yesterday morning.
Yesterday morning, okay. Do you remember what time?
Probably around 10-ish. Well, it was whilst I was walking my dog, so yeah, that time-ish.
Okay, and you said when you stop, it actually got better. How long did the chest pain last, if you can remember?
Possibly 5 minutes or so.
5 minutes, okay. Did you have any faint at all?
No.
And have you had any cough? You mentioned you were feeling a bit short of breath.
No, I don't think it's a cough per se. I think it's just that I was short of breath.
Short of breath.
At the end of it.
Yeah. Any feeling that your heart was racing?
No, not so much.
And at the moment, have you actually found that you've had any chest pain at home when you're walking?
Not at the moment when I'm at home, but I think it's more so it could have been to do with the fact that it was an incline on the hill. But right now at home, I've got nothing. Just going about my business in my house, nothing.
So in terms of support at home, may I ask who's at home supporting you?
I live with my wife, and she works as an IT engineer, so she's at home nowadays.
And was there anything in particular you were hoping that we could do to help you today, Mr. Smith?
Well, I remember that my dad used to use a GTN spray, and I was wondering maybe I would need something like that. I also wanted to kind of make sure that what I was experiencing wasn't particularly serious, or like I said, my father had a heart attack. I was hoping that it wasn't a heart attack.
I hear what you're saying. So, how much do you know about the GTN spray?
Not a great deal, just that it kind of relieved his symptoms.
And you mentioned about heart attack. Have you searched on Google about what heart attack is?
Not a great deal, just kind of the basics, where it's, parts of the heart will die and whatnot.
Right. So we can definitely discuss about GTN spray, and I will explain to you what I think is going on here. All right. So I can see on your record that you suffer with high blood pressure, and are you taking your amlodipine?
Yes.
Is your blood pressure well controlled?
Yeah, I think it's all right in the normal kind of range-ish.
And I can see on your record that you drink about 1 bottle of wine a week. Is it still the case?
Yeah, I'd say it's not really changed much.
Okay, and you don't smoke from your record?
No.
Okay. So from listening to your story, I think it's a very good thing that you discuss with us today about this chest pain, because it seems to be related to your heart, and it will be helpful if we can examine you, have a listen to your chest, to your heart sound, and do an ECG, which is a trace of your heart, to check the signaling of your heart. And it will be something that we could do down in the practice. Do you think somebody will be able to bring you down today?
Yeah, I think my wife could probably come with me.
That's good. So I think for the time being, it's probably best if you avoid driving, because if it ever happened when you're behind the wheel, it won't be safe.
Yeah, of course.
So what I would recommend that we do is that once we examine you, we check your ECG, and we check your heart sound. We can actually discuss about what we'll do next. It does not sound like you had a heart attack, because a full-blown heart attack will usually last more than 15 minutes, and it usually does not actually get better when you stop. So what I think is going on here, you have what we call angina. Have you heard of that term before?
I'm not. It sounds familiar, but I'm not 100%.
So angina is a problem where the blood supply of the heart is limited. So when you're actually doing something strenuous, like walking uphill, your heart needs more blood. And because the blood supply is narrowed, and you don't have enough oxygen because the blood supply is not going through the muscle of the heart, then you feel the chest pain. So when you rest, your need for oxygen reduces and the pain gets better. So there are things that we could help you with, such as aspirin. Give you a tablet of aspirin. I can see that you don't have any allergies.
Yeah, I know I'm all right. Otherwise,
and we could try you on the GTN spray, which is something that will give you relief when you're having this chest pain. I think we also need to consider referring you to the hospital for further assessment because of the chest pain that you're describing, and it's something that happened yesterday. So it's important that we get you to have more tests at the hospital. What are your thoughts about having to go to hospital?
I'm not like particularly keen, but if I have to, then yeah, that's fine.
I think it's important that we get you seen at the hospital, because then they can do some blood tests as well there.
Mm-hmm.
Would that be alright if we arrange that for you?
Yeah, that's fine.
If you have any further chest pain, I would recommend that you dial 999, because it could potentially be something fatal. Okay? I will see you in the surgery. Okay? One of the receptionists will ring you for an appointment. If you found this video useful, I've got 2 videos I want you to watch. The first one is RCA case on tiredness. We discuss how to assess and manage a patient presenting with tiredness. The other video is on assessing headache. This is a common presentation that we encounter in general practice. Click on the right if you want to watch the video on tiredness, and click on the left if you want to watch the video on headache. As always, make sure that you subscribe if you're not already subscribed, and turn on notification bell. Take care everybody. Bye bye.